would like everyone to picture a map of Minnesota. Now imagine a thin red line running through it, our response to drugs. For years, that thread is pulled toward punishment. Today, I ask us to reweave it toward health, safety, and dignity. Here's the heartbeat of the report's drug policing section. Punishing personal possession hasn't delivered safety. It's delivered criminal records, strained families, and deeper undergrounds where overdose becomes more likely and help harder to reach. We can keep going, excuse me, we can keep doing what doesn't work or choose what does. Let me walk you through a few scenarios. Scene one, the kitchen table, a friend overdoses, someone hesitates to call 911, afraid of police response. We can fix that fear. Legalize sterile syringes, safer smoking supplies, and drug checking tools. Repeal drug-induced homicide laws that punish grief and deter help. Stop reflexive scheduling changes that don't make supply safe. Sorry, they don't make supplies safer. Tools, trust, and information do. Scene two, the courtroom that calls itself an alternative. Treatment courts can help, but only if they follow evidence and equity. Programs must be statewide, accessible, and measured by outcomes that matter. Supervision should stop turning relapse into punishment, and universal drug testing that sets up people to fail. Recovery isn't a straight line. Our response shouldn't make it a trap either. Scene three, the sentencing grid. I know this all too well. Minnesota's framework has produced disparities and time behind bars that don't align with public safety. The report calls for a comprehensive review to reduce racial disparities and realign penalties with evidence. Build in resentencing pathways where past rules caused outsized harm. Justice can learn, policy can evolve. Being in prison, you can see the racial disparities. It's very overwhelming when you look at it. Scene four, the parking lot outside of a prison. Someone is released with nothing but $200, a bus ticket to an unknown community alone. That was me. Off-ramps only work if they exist. Fund and scale diversion programs from first contact to case dismissal, and most importantly, aftercare. Make it simple to step off the criminal path into a path of recovery. When help is easy to reach, people reach for it. If these things sound bold, they are, and it's also practical. We know what works. We know what better looks like. Fewer arrests for possession, more people choosing care because the door is open. We can narrow the racial disparity gap that decides who is punished and who is helped. Plain and simple, less people die. You might ask about accountability. Accountability without effectiveness is just noise. This approach is accountable to results. Are people safer? Are families more stable? Are overdose deaths down? Are disparities shrinking? If yes, keep going. If not, adjust. That's real accountability. Thinking back to that map at the beginning, policy becomes real in living rooms, clinics, patrols, clinics, patrol cars, and probation offices. The laws we write shape the choices people have in crisis. Call for help or don't. Carry sterile supplies or don't. Return to treatment or return to court. We design those choices, we can redesign them. So here's the invitation. Decriminalize personal possession and social sharing. Legalize life-saving supplies. Replace reflexive enforcement with community responders. Hold treatment courts to equity and evidence. End universal drug testing. Build true off-ramps. Review sentencing with racial equity as a North Star. Resist symbolic scheduling. Pursue strategies that make supply less deadly and care more available. Minnesota can be a state where reaching for help is easier than falling through the cracks, where policy is measured in lives kept, not lives kept out, where that red line, where that red thread becomes a lifeline we choose to weave together. Thank you. Let's save some lives.